Hello everyone, my name is Naomi Garcia and I will be giving an informative speech on the need to advocate for our own health. So about 3 years ago, I was diagnosed with a disease that's called Cushing's. This is a disease that affects about 10 to 15 people per million in the US, so it's considered to be pretty rare. Some of the symptoms are rapid weight gain, increased fat in the neck and the torso, fragile skin and bones, so walking, going up the stairs, anything that's considered physically active becomes very difficult for a person to do. A lot of fatigue and insomnia, anxiety and depression, high blood pressure, high blood sugar. These are just some of the most common symptoms. This disease usually affects people that are in their 20s to their 50s, and women count for about 70% of those numbers. And because it's a hormonal imbalance, women also suffer from loss of menstrual cycles as well as loss of most, if not all, of their hair. And by the time that I was 25, I actually had all of the symptoms. Before I was at the peak of me having the disease, I actually had gone to the doctor. This was when I was around 24. And I went because I noticed that I had gained about 50 pounds. I was always very slim because I was always very active. So this wasn't something normal for me. I also had a lot of acne in this area right here, and I never struggled with acne, so I was very curious to see what was going on because I didn't think it was normal. When I went to the doctor, I was actually told that I just needed to change my diet. I needed to exercise more and just change my whole lifestyle because clearly that was the reason why all of these changes were being done, and it wasn't anything medical. So something that caused me personally to stop and not push for more answers was the fact that when I told people around me, they basically told me that I should just listen to what the doctor said because that's what they go to school for. They obviously know more than I do, and that maybe I actually wasn't being as healthy as I thought I was. And after hearing that, it made me think that maybe they were right. Maybe I wasn't being healthy. Maybe I was eating worse than I used to before, and that all I had to do was change. Fast forward to when I turned 25, I actually had an accident at work where I needed to go and be seen by a doctor. And when the doctor saw me, the first thing he asked me was if I had Cushing's. Mind you, by that point, I had almost all of the symptoms, and I was basically a textbook version of Cushing's, that if you saw me, you knew that that's what I had. So that's how I was able to get my diagnosis. Cushing, something that I realized from this whole experience was that everybody usually has a very similar story to mine, which is having difficulty getting support from family and medical staff, and being able to say that you have this and having them get on board right away. Because my disease was so advanced at that point, it only took 4 months for me to be able to get my surgery. But Cushing is caused by a tumor on your pituitary gland, which is right here on behind your nose. So to have it removed, you actually need to have surgery with a neurologist. But before that can even happen, you have to go through several different tests. Like I said, mine was so advanced that I passed all those tests right away. But if you don't pass the test, then you are not able to have that surgery because it has to be proven without a doubt that what you have is actually Cushing's. Because the surgery is so invasive, they will not do the surgery on anybody unless there's solid proof that they actually have it. Once you actually pass those tests, then obviously the tumor has to be big enough for them to be able to take it out, and also it has to, the people need to know that there is a good reason to have it removed. Sometimes doctors will say that you are able to have a perfectly fine life with just medication and have the tumor at the same time, which is actually what happened to me. The first 2 months after me discovering that I had Cushing's, I had to just be on medication because they didn't really think that I needed to have the surgery until I started getting worse. After starting getting worse, that's when they were like, okay, now we need to go ahead. I've actually met a lot of men and women who have a very difficult time proving that they needed the surgery and that they actually had Cushing's. I met a girl who started showing signs when she was about 20, and it took about 8 years for her to actually have the surgery. She had to fly back and forth a lot from Alaska to California, and she actually changed doctors multiple times before she had one that would agree with her and give her the test to be able to prove that it was Cushing's, because she had already done her research and she knew that those symptoms match what she had. So the test consists of testing your cortisol levels. Usually a person has normal cortisol levels during the day, and then cortisol levels go down at night. But for some of the Cushing's, they tend to stay high all the time. But it's also very unpredictable because it is hormonal. So For someone with Cushing's, sometimes they go very low, which is when we tend to sleep a lot because we're very exhausted because we don't have that energy. So if for some reason you're tested during those times, then obviously you will immediately fail and you will not be able to have the test done to you. Every person who I've met because of Cushing's had a very similar story, and they all agree that the most important thing that we can do is basically advocate for our own health, not necessarily telling a doctor that what they are saying is wrong or telling people around you that they don't know what is going on with you, but just making sure that you ask a second, a third, and a fourth doctor for an opinion of what you think you might have. For example, I learned that every year in the US, over 12 million adults who seek outpatient medical care receive a misdiagnosis. This doesn't necessarily apply to Cushing's. It could just be anything in general, even heart attacks and stuff like that. But this basically means that 1 out of 20 patients aren't told what they really have. And having worked in the healthcare industry, I know that this is a possibility because doctors aren't always 100% sure. I hope that by sharing my story, people will be able to be active when it comes to their health, and that if they feel like something is wrong, that they will go ahead and speak to a doctor that will listen to them and give them the help that they need. Like I said, even if it means that you need to ask 2, 3, or 5 doctors and they all give you a different answer, as long as you're advocating for yourself and you're seeking the help that you need, you will eventually get to someone that will give you the correct answers. Thank you.